At a local hospital in Somalia's capital, Mogadishu, Maka Farah sits by a bedside, cradling her sick and malnourished grandson. She has brought him here for treatment from the Badbado refugee camp just outside the city. But she says there are not enough medical supplies and she cannot even afford the medication he needs. Recently, international medical charity Medicine Sans Frontiers announced the closure of all its humanitarian operations in Somalia because of attacks on its staff. Residents like Maka Farah fear that this will place further strain on an already struggling healthcare system.
I came to the hospital with a child suffering from malnutrition from the Badbado camp, and the hospital could not provide what our child needs, and we cannot afford to buy medicine for our children.
Marianne Mohammed, who comes from the Hiran region in the south, says they no longer have medical facilities in her hometown.
My son is suffering from chest pains. We traveled from the Hiran region after aid agencies left. We used to have good health care before the agencies shut down all their hospitals in the region.
The government is struggling to hold the nation out of 2 decades of conflict and provides few public services such as health and education.
It will have a great impact because we have a good relationship with MSF, and things will get worse if other international aid agencies will not fill the gap. As I predicted, the Somali government has called for MSF to reopen its operations in Somalia.
Government officials expressed concern that MSF's departure will have an adverse effect on the healthcare system in the country. MSF had over 1,500 staff working in a range of sectors.
It is too hard to cope and help all the people who need medical treatment, because there's no doubt that the Somali health system cannot afford to fill the gap. It has really affected the healthcare system for the Somali people.
16 MSF staff members have been killed in Somalia since 1991 when civil war erupted. But the charity stayed on for many years, negotiating with militant groups and resorting to hiring armed guards, something it does not do in any other country. But now the decision to withdraw has been made. It's a big blow to the Somali government's effort to persuade Somalis and foreign donors that security is improving and a stubborn Islamist insurgency is on the wane. Jane Kiyo, CCTV.